All right, guys, we're live. It's me, Brian the Birth Guy. This is our first Prego Posse live. We are missing one of our Posse people, but she'll be on with us next month, we're expecting. I'm here with Dr. Kelly Morales.
Hi, y'all.
How are you doing?
Good.
Tell them about yourself, Kelly.
So I'm Dr. Kelly Morales. I'm an OBGYN here in San Antonio, Texas, and I'm excited to be here.
Well, we have a lot to talk about today. We're going to talk about 3 subjects, and then you guys are going to have a unique opportunity to Skype in with us. And we're going to be giving away a Britex nice car seat. It's beautiful. It's the convertible click tight. You're going to love it. So anyway, we're going to tell you how to win that in a little bit. Today, people have shared some of our information today. They are also eligible to win. So we're going to announce our winner later on today, okay? So, but let's get to our topics. We're going to talk about the gentle C-section. What the heck is that, right? We're also going to talk about, in California, there's a hospital that banned VBACing. That's a vaginal birth after cesarean. And that's in my hometown, Santa Barbara, at a hospital that I did my second-year internship at. What? Santa Barbara Cottage Hospital. We'll talk about that and why they maybe have been motivated to do that. As an OBGYN, you're going to be able to let them know. We're also going to talk about preeclampsia. What the heck is that, and why is it so scary? And what are some things that you can know how to predict it if it's possibly happening? Get in touch with your doctor, and also kind of what happens in the hospital if you do have it. So we're going to discuss all these things today. Kelly, you're just off call, right?
Yes, I am. I'm post-call.
Yes. So she's here with us right after being on call all day. We're going to have such a good time. If you guys have questions as we're going along, go ahead and just put them right there at the bottom. We're going to try and address them, and we're really excited to be here. So let's talk about the gentle C-section. So let's talk about like a normal C-section.
Right.
What was a normal C-section usually like, Dr. Morales?
So a normal C-section, you are numb from the waist down. If you've already been in labor, you're going to head to the operating room with your epidural running. Or if you haven't been laboring and you're going in for a repeat C-section or a primary for some reason, then they will get you good and comfortable and numb from the waist down. Usually your arms are out on arm holders because the operating room bed is very narrow. And usually the baby will be delivered and then immediately the cord is clamped and cut and the baby's handed off to the waiting personnel and dried off and bundled up and kind of kept there for a few moments, or sometimes brought off to the nursery, and mom and baby are separated while mom finishes the C-section and everything is closed up. But what we figured out is that that's not really in line with how physiology is supposed to work, and that there's this really critical time of bonding that happens right after baby is born. Now we get to maximize that bonding in a vaginal delivery, because baby's right there, mom's right there, and we're able to do some skin to skin right afterwards. Well, somebody somewhere, some smart guy somewhere, right, came up with, why can't we do skin to skin right after delivery? Why can't we do delayed cord clamping right after delivery? Why does mom have to be tethered out in that position as well? So,
because the hands are binded down. Well, they're usually tethered sometimes.
In some places, yes. In some places. So now, step by step, looking at the C-section, we're thinking, okay, how can we make this a more comfortable surgery for mom? How can we make this more of a bonding experience for mom and baby? And what can we do to keep baby from getting taken away from mom right away? Yeah. So there are just a couple of really very simple, subtle things that you can do during a gentle C. This isn't like some crazy rocket science or something that you have to pay extra money for or something like that. I mean, it's a matter of, first of all, giving mom a little bit more movement. So maybe the arms aren't tethered. Yeah, there's some arm resting boards because there's not really another place for her to put her arms, but she can move them if she wants, especially after baby's born and baby is dried off and stimulated and transitions real quick, and hopefully that just takes a few moments. Yeah. Baby can be brought to mom skin to skin. Shocker, right? Because we're busy down with the actual surgery itself, but the baby can come over to mom. And sometimes I've even had some moms that are actually nursing right then and there.
Sometimes we did that 2 weeks ago in the OR together.
There's not
you and
really any reason that can't be done from a surgeon's perspective. So if your doctor's comfortable with that, baby can be brought to you skin to skin. Mom is distracted with baby and skin to skin and smelling and getting that bonding going. And it kind of actually helps our job a little bit, because now she's not asking, "Are you done yet? Are you done yet? Can I hold my baby
Where's
yet?
my baby?
Where's my baby? Are you done yet?"
She had that baby in her 40 weeks,
right,
or almost 40 weeks
Yep.
anyway, and she wants to hold her baby.
Yep.
Mom and babies don't want to be separated. It's not how normal mammalian birth works. So check this out, guys. I'm going to back up a little bit to talk about how the gentle C-section even came about in the U.S. I like to say it was my friend David Goslin, who's also one of our sponsors tonight with Doctors Complete, and we'll talk about that a little later. David Goslin looked at the Australian gentle C-section and said, I'm going to do it here in Santa Monica. We're in San Antonio right now, you guys. I know we have viewers coming in from all over the United States and even in some other countries, but I'm going to tell you something. He brought it to Santa Monica, and it's a fantastic thing because it empowers families, not just women. And that's a trend. Everybody says we work in birth because we're just trying to empower women. We're empowering families because we're not going home with them, are we?
No.
Their family is. Their partner is going with them. So we're going to talk about what happens in the C-section kind of, well, I call it a vaginal bypass surgery too. So we're going to talk about what happens in that. And a lot of times people don't come in thinking they're going to have one. They may have come in thinking they're going to have a natural birth or a normal birth, which means they're going to have an unmedicated birth. Right? Mm-hmm. And something goes wrong. We're monitoring baby. There could be decelerations.
Right. It could be for a mom and baby indication, a mom indication.
Yes.
Maybe labor isn't actually progressing.
We're stuck.
And we're picking up on some clues that this is not going to go well. You know, we may be predicting a shoulder dystocia. We may be on the forefront of an infection. You know, something is happening that, okay, the vaginal route is not going to be the safest or the correct route for mom and baby.
And I hate to say the baby won't fit, but I've seen some cesarean deliveries that I've been in where the baby comes out with a cone head because the baby is trying so hard to get
wedged in there.
Out.
They can't navigate their way out.
And that's wild. I mean, the look in the room, it's so funny when nobody's seen that before. It's like, the baby has a cone head and it was a cesarean delivery.
Usually it's the partner going, that's going to go away, right? That cone's going to go away.
It does. It's not like the old Saturday Night Live skit, huh? Okay, so what happens, you guys, this is kind of cool. Generally, it's done very peacefully, and mom and a partner are wheeled over to the OR. And I like to inform guys in my Rocking Dads course that they're not going to go with mom into the OR in the very beginning because they have to get mom prepped, right? Mm-hmm. They have to do sometimes they're going to do a spinal block if she doesn't have an epidural in, or if the epidural doesn't work for a spinal block, the anesthesiologist is going to have to put one in, correct?
Right.
And so what happens is, then dad's going to be suiting up. And I always say, if you're going to put your little suit on, you're going to put the booties on, you're going to have the hat on, the mask, take a selfie because you look all doctored out.
Yeah,
right?
Leave the phone out of the pocket because usually the phone goes in the pocket and then you're all bundled up and you're ready to go. And it's like, where's your phone? Oh, I got to undo all the zippers.
You can't get in and you're in the OR and you're nervous because your baby's being born and you're trying to comfort your partner, right? Mm-hmm. Yeah, so I tell dads, keep the phone out. And I'm going to tell my secret trick, which is when baby actually is born, dad comes in right before. Dad will put hand, I say, on mom's head and hold her other hand. Talk to mom. Tell her about the first time you guys met. Tell her about something romantic, how proud you are of her, how excited you are to be starting your family with her, and how she's going to hold her baby. Because a lot of times, there's two different types of strengths it takes to have a baby. The strength in a vaginal delivery and the strength in a cesarean delivery, because those are the only two ways you're going to have a baby, pretty much, right? And
I know of.
Yeah, me too. Well, if they find some other way, we're going to know about it. Right. But so what happens is, with the vaginal birth, it takes physical strength. It takes, pain coping and things like that, right? With a cesarean delivery, it's different because mom has to now relinquish control. And one thing I think that's amazing about the gentle C, and you did it too, you said, okay, mom, help me push a little bit here. I need you to push a little bit here.
Yeah, I had my moms do a little crunch, a little push.
Yes, try and curl up a little bit. And when they do, they are now interacting in a way that we never see in cesarean deliveries.
Right.
Yeah, I've seen Rob Schulmer do that, though.
That's where I got it from.
Did you really? Yeah. Isn't that great? Oh, we're giving you, we love you, Rob. So he's just an amazing OBGYN here. He's like my dad. He's wonderful. Okay, look, I got chills. I love him. So anyway, so it's incredible because dad gets in there, but then when baby comes out, they usually show baby over the curtain that mom has a little divider thing here coming up so that she doesn't have to look down and see the surgery going on unless she wants to, and you can be very transparent in gentle C, correct?
Right. So some hospitals actually have these drapes. These are surgical sheets that have a clear portion right here so that mom can see baby being born. In my experience, it's a little difficult that way, though, because there's a baby bump, there is a blanket, there is a whole other sheet. So it can get kind of difficult to see baby, but what we have at our hospital is a mirror, and mom can actually look at that mirror and see baby being delivered that way. And also, and this isn't always a good thing, but the surgical lights, you can sometimes see the reflection. So I've actually had a couple of moms before, they're like, no, I can see too much. But
don't go to the light.
Don't go to the light. Don't look at the light. But it's kind of cool. That's a really powerful moment when mom sees her baby coming out, when she sees that baby being born. I mean, that is a really incredibly powerful moment, and it's just a beautiful thing. And many hospitals, I can't speak for all hospitals, but many hospitals will allow you to take pictures at this moment. I don't know of any hospital that will let you do videotape, but pictures, and make those pictures black and white, kind of makes it look a little bit less surgical. But it's a really cool thing to be able, for mom to be able to see baby coming out, because it's really cool. It's
life starting. Mm-hmm. It's incredible. That seeing your baby's first face, there's something about that for sure. Right. But so what I like to do is when they pick the baby up and show mom, here's your baby, mom, dad, take a picture, okay? And then we're going to take the baby over to the warmer. Because when you have a cesarean delivery, there is obviously something going wrong, or there's a precaution you're taking, or mom has already had one, but just in case, they have the perinatal group in there just to check out the baby, right? They want to see it, make sure everything's cool. So they're around the warmer to greet your baby. I tell dad, take a picture right away when that baby goes over the curtain, because they're going to take the baby away from mom, and she wants to hold her baby. This baby is now being taken from her body and away from her. No mammals have that happen. However, in our society, we have so many babies coming out. A lot of them shouldn't make it, and we're lucky enough to have the technocratic society we have, with the room down the hallway that we can go have surgery if it's necessary. So I want to tell you guys real quickly, dad takes a picture of baby and then shows mom, and becomes that perfect announcer, and says, okay, so check it out. Baby's kicking the leg, baby's kicking the hands, we're doing this, we're doing that. Well, and so you can be that announcer, you want to be the sports announcer. You can even make funny voices if you want, but she needs to see that baby's face, and that's an incredible thing. The gentle C is a wonderful thing, because then when baby comes back to dad, we just get that baby all unwrapped right on mom's chest, and we even initiated breastfeeding 2 weeks ago, right there. And it was awesome. Yep. That's how the Prego Posse rolls. We're going to break for some information about one of our sponsors. Okay, guys, you ready? Check it out.
There's some questions on there.
I just want to say that. It's so fun. Check this out. I want to thank all you people for joining us. Oh, Candy, Miranda, Enrique, Adriana, all these great, wonderful people. And I want you guys to share this video. Share it. As we see shares, that's going to help you get closer to winning that Britex Boulevard Click Type Convertible. What's up? That's a $380 value. I want to thank Britex for supporting me and for supporting our show and allowing us to give away such a great product. Okay, Kristen had a question. And Kristen, I was with her last baby. Kristen, can you do delayed cord clamping with a regular C.
Yes.
Yes.
So
there's no reason not to.
The big caveat with any delayed cord clamping, whether it's a vaginal delivery or C-section, is baby's got to be vigorous. If baby comes out kind of limp and blue, you want us to resuscitate that baby. You don't want us to take a minute, waiting to clamp that cord. But absolutely, it can be done at the time of C-section as well, provided that your surgeon is comfortable with it. Which I think as we progress, I think more and more surgeons are going to get on board with doing the delayed cord clamping. It's probably going to become a normal thing with time.
I love it. Okay, so Kelly had a quick question. Kelly says, I'm 38 weeks and I'm only 1 centimeter. I'm nervous about being induced and needing a C-section if my cervix doesn't ripen enough. Okay, Kelly, I'm going to answer a little bit. I'm going to let the other Kelly answer a little bit for you, but I want to tell you something. At 38 weeks, you're not to full term, and actually term can go all the way 41 to 42 weeks sometimes. So you're at 1 centimeter. That means you need to change your paradigm and stop talking that you're worried about this not happening. You need to embrace that your body's working and you're already 1 centimeter. Some people aren't even 1 centimeter. You need to start saying, my body's working. I'm ready to have this baby when my baby's ready. I'm going to enjoy these last bits without my baby being here, with my partner, my family, whatever, your support and the things that you love doing, because your baby's going to be here soon enough. I promise you, your baby's not going to leave for 18 to 35 years. Okay, so you're going to be stuck with that kid. So I want you to really turn it around. And I think that when you say things that can be negative, like, oh, I'm worried my body's not going to do this, just say, my body is going to do this because I'm already at 1 centimeter and I'm going to be holding my baby sooner than I know it. So just let it happen and make sure to get plenty of rest, do a lot of walking. We're all adults here. You have to have intercourse with your partner because there's semen that has prostaglandins that help ripen the cervix. That's a good thing. You're welcome, gentlemen. Okay, Kelly, do you have anything to add to that?
No, basically what he said. I think 38 weeks and 1 centimeter, that's awesome.
Yeah.
That is much better than closed. That's much better than, just a little fingertip open.
We love it.
So, yeah,
Ooh,
that'd be great.
Rob Lenza, the CEO of Methodist Children's Hospital, and our L&D has just joined. Hi, Rob. We're glad to have you with us. I want to say Kirsten Franzen Bruner. I should know how to say your name a million times. Kirsten is my co-author. Hi, Kirsten. Thank you. We're giving a lot of good info. We're going to get on to the next thing in a minute. Kelly, I was about the same. Oh, you're telling Kelly, the other person. Okay, thank you, Kirsten, for doing that. Love the birth guide. Thank you, Michelle. Maria Alps joined. Enrique, having you there to keep me calm while they prep mom was invaluable. Thanks again. It was great being in that cesarean with you guys. You guys had such, like, getting chills because you guys had such an incredible story behind you, and I'm so glad you have that baby with you now. Wonderful couple. Sarah, thanks for joining. Marco, thanks for joining. Tori, Kristen says, do you find it to be more? Go ahead. You got it already.
So Kristen wants to know if it's more important, do we feel it's more important for a mom to be able to see the birth of baby at a C-section because she can't feel that baby coming out compared to somebody who's delivering vaginally? And actually, having had 2 C-sections, I can say you do feel baby coming out. It's just a little bit different sensation. It's from a different place.
Yes.
There's a lot of pushing on your belly, and like I said earlier, I actually have my patients do a little bit of a push or a crunch. So I think it's important either way. And we offer women a mirror at a vaginal delivery so that they can actually see baby coming out during a vaginal delivery, the same as with a C-section.
I highly recommend having the mirror because that's a motivation. And if you've had an epidural and you're trying to push, you're pushing non-directed. And so you're trying to push, but you know exactly where you're pushing. And when we say, just like that, because that's a common thing you're going to hear when someone's pushing, just like that, and you look, you can kind of see how you're pushing, and that makes it a little more effective.
Yeah, when you're pushing with the vaginal delivery and you see baby's head, and that baby's head is coming down, curly black hair, you see that head coming down and you're thinking, oh, when I go like this or when I push like this, I see more of that head. I know that that's much more effective. So I think a mirror has an important spot with a vaginal delivery. It's just for a different indication, kind of.
Yes, absolutely. Okay, so Kristen says, but she's definitely scared of the possibility of a C-section and not being in control. Yes, I know that, hun. That's why you hired me the first time. Okay, but I love the idea of a gentle C. It's awesome. And she says, also suck fools. And she says that because we were trying to get her baby to breastfeed. It's the most hilarious thing. And he kept falling asleep right on. And she goes, suck fool. And then he started sucking. Awesome. It was awesome on the first lap. So I've never heard anybody tell their baby, suck fool.
Right?
That's hilarious.
You know, it's normal to be worried about a C-section. This is not something that, as soon as you see that little line on the stick in the bathroom, you're like, yay, I'm pregnant. Oh, I don't want a C-section. So it's normal to be a little anticipatory about it. It's also normal to be worried about a vaginal delivery, worried about maybe the pain that you might experience. It's normal to be worried about the diapers and what happens whenever you're in Target and you don't have an extra diaper and you've got an explosion on you. I mean, there's so many things along the way that you're going to be worried about.
Right?
Absolutely.
Good gravy. We've had so many people join us. Aileen says she's 37 weeks, and this is great for her to hear. Thanks. You're welcome. We're so glad to be here. We're going to do this every month, and we might do it twice a month. We need you guys to share it with your friends. Bring more people on so we can do this. We want to give you the information you want to talk about. You just have to message us or write something on our wall, things you want to hear, the topics you want to hear. We're going to talk about them. We love that. We also had Alexa Grossman-Rubin. That's my manager. She's on. Hi, how's everything in New York, Alexa? Okay, Kelly says, thank you for addressing my concern. No problem, Kelly. We're glad to be here. Brenda says she's 37 weeks. I want an induced labor when it's better. 39 weeks, or when's it better? 39 weeks or to wait till 40? James Garcia says hi. We're going to answer that in a second.
Sure.
From Montabella. Hi, James. Lindsay Joy says hi. She says she's just curious why do you have your patient crunch? Let's go back to this one real quick here. Yeah. When do you think she should induce?
Depends on why. If it's just because you're tired of being pregnant, you just are ready to be done, you're ready to have this baby in your arms, really the later that you can wait, the better. With the caveat, anytime after your due date, nothing good really happens. The placenta's getting old, the fluid can get low, meconium increases. The risk of needing a C-section
meconium is where they poop.
Right, so all of those risks kind of increase after your due date. However, if we try and push the issue and try and get your body to do something it's not ready to do, like an elective induction at 39 weeks, we might as well be filling out the orders for the C-section, because we, again, could be trying to get your body to do something it's not ready to do, or that baby's not yet going to have the stamina for.
Yeah.
So 39 weeks is acceptable if your cervix is already opening, it's already softening. If there's already signs that you're kind of around the corner from spontaneous labor in the first place, or if there's an indication, if you're having high blood pressure, if you have diabetes, if there's some other problem going on in the pregnancy where we're worried about you getting to that due date point and those bad things happening.
What if your doctor's going on vacation?
Probably not a good indication. It's probably not a good reason.
So check this out. And I want to say, if you can just simmer down a little bit sometimes and just wait till you're closer to the 40-week mark, you're probably going to go into labor, because most people do. So if you don't, then you look at those choices. But you have to understand what induction is, and that's a topic we'll have to cover another day, because we still have a couple other topics to cover. We're almost out of this one. Lindsay says, just curious, why do you have the patient do a crunch during a C?
So when you crunch, you're actually engaging your muscles that you would normally be using whenever you're pushing. And I like my moms to be engaged in that process, because a C-section, as mentioned before, you're kind of out of control and you're kind of not necessarily involved with the process. If you're doing a little crunch and you're doing a little push, you are a little bit involved. Yes, we're still pushing on your belly, but that gives you that sense of you're contributing to that process. And I think it probably also helps as well.
I think so too. I love it. And I love that mom gets to be contributing.
Right.
And she feels that psychological part of the game, where generally in a C you're not. You don't know what's going on. When someone's telling you to push, you know you're expecting your baby to come shortly. We had another question. She says, I hope this video is available later because my Wi-Fi is awful. It will be available. You can watch it all the time. We're going to keep it up, and it's a good thing. And I'm glad. Share it with your friends. That's how people get to know we're around. The Prego Posse is here for you guys. We love to get down and talk about everything baby's birth, breastfeeding, and parenting. We'll even tell you what we ate for lunch if you want to know. Breastfeeding 10 years after a breast reduction. Any tips? You're going to have to see how it goes, depending on how your breast reduction went. But you have to be patient, and you have to really just pay a little closer attention. I would definitely go after your milk comes in. If your milk, when you start feeling your milk come in, go do a weigh-in feed so you have some mental calmness. So which means you go to someplace like a WIC office or baby cafe, or even to the lactation center at your hospital. Go weigh the baby, feed the baby, then weigh the baby again. That can make you feel a lot better. The other thing is, if you're not seeing pee and poop diapers right off the bat for the first day when you latch that baby, you should see at least one pee and poo the first 24 hours, two the second, three pees and poos the third 24 hours. But you're definitely probably going to see a few more. If you're not, you may have a problem. So we need to take a look at that. Do you agree?
Right. So after a breast reduction or augmentation or any kind of reconstruction, there are a couple of things that can make it a little bit more difficult or less successful with breastfeeding. So right off the bat, I say if there's any concern whatsoever, before you even deliver, it's a good idea to get hooked up with a lactation consultant so that they can look and see, okay, first of all, is the anatomy what it should be? Is the sensation what it should be? And kind of give you some tips and some guidelines on how you can be successful at this. There are a couple of things that can happen right after any kind of breast surgery that would be a tip-off that it might be a little bit more tricky, like if there's any wound healing problems, if you have any loss of sensation, so well, this after surgery, this entire one side was numb. That might be a tip-off that things might be difficult for that one side. But regardless, if you've had any kind of augmentation or reduction, you should probably see a lactation consultant beforehand.
Yes. And you said it should be a tip-off, not a nip tip-off?
Right.
Okay. So somebody asked if we do any Facebook Live. If we do any YouTube Live. We don't, but we make a great team. Thank you. We love working together. We have so much fun in all aspects. But I'm going to tell you, one of the best things is before you get to the labor room, getting information like this, finding out some other perspectives. That makes all the difference in how you deliver and how you and your partner experience this, bringing a baby into the world. It's a really big deal. It's an important thing, and it's an incredible thing.
And then talking with your doctor about some of these ideas and things.
Yeah, we should do the birth plan next time.
We'll do the birth plan next time.
Yes, we'll talk about that.
I can say on here all day long what I do as a physician, but probably in the delivery room or in the operating room is not the time to bring up, hey, by the way, I want to do this thing that I heard about before. So talk to your doctors before you actually get to the delivery room.
Okay, Kristen says, is it bad if you're already leaking at 27 weeks? No, that means you're going to be produced just perfectly. Yep. So that should give you confidence. Embrace that as a confidence that you're not going to have a problem producing. So all you have to do is get your latch down. And, we'll probably cover the latch at some point because there are specific things about the latch. No one ever follows that. I can't wait to tell you guys about. Okay, we have another person says, Whoops. She says, thank you for answering. I feel confident. I'm glad. That's what we're here for. That's awesome. Daniel Campbell says, hey, Brian, I just want to thank you for the Rocking Dads course. We have a healthy baby boy. You'd helped a lot during active labor. Unfortunately, we went to an emergency C-section, and everything was a blur. But your class helped me stay calm and help my wife stay calm. That's so awesome. Thank you so much. By the way, you guys can go to www.rockingdads.com, and we have an online course. So if you're not here in San Antonio where I teach live, you can get it right there for $19.99 or $39.99. You got to find the coupon. All right. I don't know where it's at, to be honest with you guys. I want to tell you guys, we're going to talk about something now that's kind of I'm going to put this down for a second. We're going to go back to your questions in just a few minutes. But I want to tell you guys something. In the city I grew up in, this is something that drives me nuts. I cannot believe they just banned doing VBACs, and that's a vaginal birth after a cesarean. And actually, we just filmed one for ABC that's going to be airing in September. We filmed a VBAC because they're totally doable. What do you think is propelling this with them to say, oh, we're not doing VBACs here anymore in the hospital?
From a provider's perspective, it's got to be a situation of can the doctor be there? Because the doctor's got to be there 24/7 during that process. It's a huge potential liability because things can go from perfectly normal to perfectly bad really fast. So
in any birth.
So we have to be there practically at the bedside for VBAC the whole time. And then if we have call partners or anybody in our group that doesn't do VBACs or doesn't feel comfortable with VBACs, then that even takes them out of the picture. So I think it's probably more of a time and a liability issue more than anything else. The stars have to be aligned. You have to be a good candidate. We have to feel that that it's going to be a safe option for you. It's probably the thing.
I think you're absolutely right, and Dr. Stuart Fishbein, who's one of my mentors and great friends, he feels the same way, and he actually was talking about this on his podcast, and I'm like, Santa Barbara Cottage Hospital, really? Because we're so hippie in Santa Barbara usually,
Right.
That's
called the cottage.
Yeah, the cottage hospital, right? Not so cottagey, but nonetheless, I really feel it's the same thing. They don't want to. Some of the doctors in the call group don't want to commit to that type of responsibility, which I know that some people in this city get that every once in a while, but it's it's just what you do. And every VBAC that I've seen you at, that we've worked together at, you're there. You are so within an arm's reach, and that's amazing. Yeah. So I got to give you props. You're one of my favorites in the world.
Thank you.
In this whole big world. Let's see if we got some questions. That's all we're going to say about that, because that is like a topic that is just, what the heck? We don't want to see that here, you guys. If we ever see anything happen like that in your city, go out and go make some noise. You have to be part of the change, which means you have to go out and you have to talk to your hospital. You have to get big groups to write a petition. You should have choices. It's your choice when you're going to have a baby. It's your choice to be able to have the baby the way you want or as close to it as possible. As long as it's safe. Correct?
Well, and that's, I think, the big thing too. As long as it's safe.
Well, I put that on there.
Right. If your doctor is just telling you, nope, you can't, find out why, because they might have a really good reason. For example, your baby's breech. Sorry, not a good VBAC candidate. You know, it's probably not going to work out that way. If they're suspicious that your baby is too big, or they're suspicious about the kind of closure that you had, or what they've read on the operation report from your last C-section.
Sure.
So they might be seeing something that is making them nervous about offering that kind of delivery. So talk to your doctor, find out, say, hey, you know, is it even an option? If it is an option, what are my risks? What are the risks of a vaginal delivery? What are the risks of a repeat C-section? And if it's not an option, why? You know, is it something that you're worried about with my delivery or with my past delivery?
Right. Well, one thing I want to do that we haven't mentioned yet is that one of our producers tonight is very tired because he happened to welcome his baby girl to the world last night. Yes! Adam and Arlene welcomed their little baby last night, the Annihilator, Annihilea Ortiz, and we're really excited that she's here, and we're really excited for you, Adam. So thanks for being here for us. All right, you guys can't see him. He's really not there. It's an invisible person. I made that up. But no, they are. They're wonderful people. We're really glad to work with them.
It looks like he's been up all night.
Absolutely. Okay, check this out. So Kirsten said she's going to be delivering in the operating room, hopefully vaginal delivery. Yay, twins. I know I'm going to be there in Houston. And anything special that I should ask my doctor that may be different than what I experienced during her normal vaginal delivery?
Yes.
You can answer that one.
Right. So first of all, the setting is different. We do it in the operating room because things can kind of go south quickly with twins. So we want to be in the operating room where we can do an emergent cesarean, really, in case something happens with the second baby or the first baby. It also gives us a little bit closer access usually to the NICU in case there's anything that goes wrong. It gives us a little bit more space as far as like more people and teams of people to address the babies. I know when I do a twin delivery, I want to do an ultrasound right after delivery of twin A so I can find out, okay, how is baby A's heart rate or baby B's heart rate? You know, how's everything going with this twin that hasn't come out yet? I'm reaching on the inside. I'm trying to find what's the next presenting part. So there is a lot more pressure involved. There's kind of some more fuddling and some more things going on around the outside of you. And there's definitely a lot more people in the operating room compared to just your standard.
It's a party. You guys can do the wave. Do the wave when the baby comes out.
And if you've got two babies, that means twice as many people. So just be prepared for having a lot of people, and it may seem chaotic, but it should be controlled chaos, and it probably is.
Yes. Okay, we have another one. Can you lose colostrum if you leak too early? That is one of my fears, that I will lose all of it since I'm leaking a lot. No. Nope. Your body knows when it's time. Okay, really quickly, we usually talk about this in breastfeeding. Your body knows when it's time for your milk to transition. Either when, like late-term babies, sometimes the colostrum will look less thick, I see a lot of times, but it's because your placenta is in your body, and it keeps high levels of progesterone in your body. So progesterone's a hormone. They work lock and key. Your body has to make prolactin, which will help your milk to come in from colostrum. But you need the colostrum because your baby's tummy is only really tiny. It's like the size of a shooter marble. It's really small. So over the next few days, it's going to get bigger in order to hold like an ounce and a half, right? I don't know the street value of that, but nonetheless, it's invaluable. But so what I was going to say is that with the prolactin coming in, prolactin's at a low level, progesterone's high, this is going to start shifting and going up and down like this. So as progesterone starts going out, prolactin starts going in because they are twins, and then your milk will come in. But your colostrum will not be non-existent if you have a placenta in your body. As a matter of fact, when they leave residual placenta inside of your uterus, moms will notice their milk isn't coming in. And if you're getting clumpy bleeding, that's a little different than the normal bleeding after birth, you need to do something about that. Talk to your doctor and say, I'd like to check for residual placenta. Okay, guys, we're going to take another break here because we're going to hear from some of our sponsors. We're going to answer more of your questions. You guys keep sharing because awesome. I think we're going to have a winner for that Britex convertible, and we're really excited to give that to you guys tonight, and we're really excited to have the wonderful sponsors that we do have. We'll be right back after these messages. All right, we're back, you guys. This is an exciting night. We're having so much fun, and we are so glad all of you guys are joining us. We keep looking down here because we're like, look at all these wonderful people supporting us and listening to these great things. Yes, James, we're going to be back, Gloria. VBAC Ban in California, well, in some of the hospitals, for sure, at Cottage Hospital in Santa Barbara, and hopefully that gets lifted because, the public's speaking out about it, and I'm glad. Someone else asked a question here. Let's see, Kevin Bailey says, swipe to the right to remove comments. Arlene says, Brian and Adam, I'm blessed to have you with it. Yes, you know what? You're so welcome, Arlene, and we're glad that you guys had your beautiful baby last night. Todd says, great interview. Thanks, Todd. Thank you, Ashley, for joining. Todd Van Buren's joining. Andrea says, what birthing classes do you recommend? Okay, so check this out. You have to find one that speaks to you. And generally, for me, I train in several different birthing methods. And I find that I kind of teach my own vibe. But the universe brings me my clients. And I see a lot of people every month, a ton. And let me tell you something. You got to find what speaks to you. Go look at the different educators in your area. Find out what kind of classes they do. For me, I don't do series classes because series classes, how many people can commit truly to like 6 weeks of classes going for 2 hours a night? And there's a lot of fluff in them. One of the things that I train in, you have to draw with chalk and this and that and draw like a labyrinth and this and that. And a lot of people don't want to do that. For some of you, that speaks to you and that's great. For most of you, probably not. So generally, I like to work with dads myself. First, I work with a group of dads, then I will work with a couple, and I like to work with couples one-on-one. Group classes are fun, but one-on-one to me really seems to sing to me and speak to me because it's important that you can speak freely about what's important to you, to the person you're trusting, guide you through this journey. Okay, so go look around, shop around, find out what speaks to you. What do you think?
Hospitals will typically have some classes, and they are going to be very generic, I guess is the best way to put it, because there are going to be certain things that are provider specific. So if you go to a hospital class, make sure to write down your questions to take them back to your doctor's office and say, well, what about this? And I went to the birthing class and they mentioned this, and how do you feel about this? Doctors' offices will sometimes have birthing classes. There's online birth classes. I just think it's really important to get educated and get communicating well in advance. So in your third trimester, the last month of pregnancy is probably not the time to figure out when to get educated on it because it's going to come at you fast and furious.
I like the dads to take it early. So if there are any dads out there, by like 18 weeks, that's when you should be taking a course, either with me or online. I have my course online at rockingdads.com. There are so many other ways for you guys to reach people too. Find something that's significantly where you can get together with a group of guys that's not just talking about how to put a diaper on. If you can't put a diaper on, how did you get someone pregnant? And how to push a stroller and sing to a baby. No, you need to learn about your relationship. You need to learn about what happens at making a birth plan, what happens in early labor, medical interventions, non-medical interventions, Z-section, breastfeeding. There's so much for you to know about. So make sure you get something meaty, not something cheesy. That's what I have to say.
There's sibling classes out there. Yes. I even heard of one, and it was a birthing class for pets or something like that. Like how to adapt your furry family to...
Oh, I thought you meant to help a dog have a baby.
Yeah,
That's a midwife.
That too.
There's a midwife.
Yes, no.
It happens. Okay, you guys, we're going to talk about our last topic in 1 minute. Let me see what else you guys have to say here. Hi, Amber Weiner Gebhardt. I love you, baby. She's so awesome. Gloria says, I had one in 2013 and 2015. No problems out of the ordinary. What's the reason for the ban? We were just talking about that it's probably that, the provider that accepts VBACs, their call group probably doesn't want to do that because it takes a lot of time. It requires a lot of time to be there. There's, there is a risk, but the risk is pretty similar to having a C-section. They kind of weigh out like this, so you got to look at that.
Anesthesia's got to be in house.
Yes.
The provider has to be in house.
They have to be in the house.
Monitoring. It's just logistically speaking, it can be really difficult. I can say this though: there's this huge myth out there that it has something to do with cost and maybe how the hospital or the doctor gets paid more for a C-section.
That's a myth.
That is a myth. The amount difference.
You get like $13 or something.
It's negligible.
But the other doctors do get paid in the hospital. They get a longer hospital stay, so people stay in the hospital longer. So the hospital bill goes up, but you're walking away with just a slap on the back.
Here's a Starbucks coffee.
Yes.
So we're not making that decision based on that.
Yeah. So, but you're not one to want to get in the OR. You're such a vaginal birther. It's amazing.
I am a vaginal birther.
You are a magician, is what you
Right.
are. The magician, right here, sitting next to me right now. People live on Facebook. That's Dr. Kelly Morales, OBGYN. Like her page. You can find her on my page right here where you guys are at, and she's awesome. And we're going to be doing one of these a month. We can make it up to 2 if you guys keep sharing this with your friends. Share, and let's see what happens. Thank you for all the hearts and the love. Let's talk about our last thing. Curtis is on. Hi, Curtis. Curtis is I mentored Curtis, and I love him. He's a male doula.
Look, there's Cassie Ott.
And Cassie Ott is here. She's one of the nurses that we work with a lot. Cassie, thank you so much. And she loves that we're doing the gentle C's, and it's her favorite to participate in them. I love the breastfeeding on the table. Me too. Natasha says, almost missed this happy. I made it. I'm glad, Natasha. I'm glad you're here with us. Check it out. Our last topic is something that is a little bit mystifying to some people because they don't exactly understand what it is. It's preeclampsia.
Mystifying to some people. It's been mystifying us ever since the dawn of time.
And it gets cray. It's important that you identify if you're getting some swelling in your leg. Preeclampsia means that not only do you have high blood pressure, but you got protein in your urine. What does that usually indicate?
Well, so it starts with high blood pressure, which can affect your kidneys, and then your kidneys don't filter correctly, so you're going to put some protein in your urine, and you're going to start spilling some of that fluid into your ankles, and so you get swelling, and then you can end up getting some of the fluid in your neurological system, so you start getting headaches. So there's little subtle symptoms and things that kind of start off initially, right? Just some vague things, and then they just kind of snowball out of control. I mean, you can go from completely normal, healthy pregnancy, you are walking and exercising, you're eating all the right foods, you're doing all the right things, you've picked out the right crib, and you're not putting crib bumpers in your crib, and then all of a sudden you've got kind of a little vague headache, and you notice, I'm getting a little more swelling than usual, and you go to your OB appointment, and your blood pressure is sky high. It's like, where did that come from? I've done everything right. What, why me? Why is this happening? So, it's scary when it happens, and it can go, as we say in the military, you can go from flash to bang fast. Like you can go from completely healthy to just all of a sudden, it's bad. It's a bad deal.
And you're in the hospital, and when you get in the hospital, you're going to have an onslaught of tests. They're going to have to check to make sure, what your labs are like. You're going to get in there, you're going to be monitored. Your blood pressure is probably a little out of control, which gets scary, which means that, you're fresh and primed for a possible cesarean delivery. And then they're going to have to administer magnesium. Why do they give magnesium, Dr. Morales?
Magnesium sulfate is an IV medication that actually reduces your chance of having a seizure. Because one of the end results of preeclampsia, when it's left out of control, is a seizure. And that's not good for you. That is not good for baby. Your placenta can separate. Baby can suffer from that. So the magnesium sulfate decreases that risk.
Great. Well, but the magnesium, what people don't understand is the magnesium sulfate can also go to the baby. Well, it does also go to the baby because the baby's in. Mm-hmm. So when baby's delivered vaginally or cesarean, if magnesium has been in for a certain amount of time, baby's going to have to go to the NICU.
Potentially, because it can cause babies to be a little bit more sleepy and a little bit less ready to go from that fish environment to the human environment. So they don't always have the same respiratory drive that they would ordinarily have. Although I've seen several, recent deliveries actually on magnesium, several babies kicking, crying, feisty. You would never know that mom was on magnesium.
And it's okay for them to eat because moms can't eat after the magnesium for a little while longer, correct? Sometimes?
Potentially, yeah.
Yes. So there are just these little things to be aware of because when you go in and you don't know these things, it kind of sucks when they say, oh, sorry, you just had your baby, but you can't eat. And guess what? Can't feed your baby either right now for a little while. We're going to give the baby some sugar water or something like that. So always know, don't just look at the one scenario. You have to look at all the scenarios because when you understand that and you understand what's happening, it's not as scary because it's not just being thrown at you at that moment. You go, you know what? There's a reason for this because we don't want the baby to get sick. We don't want that, the baby to aspirate, or we don't want me to get sick. So I can't take care of my baby. So we need to follow the rules of it. But when you understand just the different degrees that can happen, you don't go in blind. You have a flashlight in a dark room. It's kind of the way I always say it. Like, imagine you walk into a room and there's furniture everywhere, and then they shut the lights off, and you got to get to the other side of the room. You're going to bang your legs up, and you're going to get upset, and it's going to be harder. But if you have a little flashlight, you can go small steps at a time and make your way and not get as injured. And I feel like when people really prepare themselves and understand some of the ways things can go, those treacherous paths, they all lead back to one path, hopefully, which is the path of you and your baby being right back together, both of you guys being healthy and eating.
with preeclampsia too, there are a couple of risk factors. So if you're just hearing about this for the first time, you're going, oh my gosh, I've got swelling, I've had headaches, maybe I've got preeclampsia. Don't panic. We're watching your blood pressures in clinic. We're watching your weight. We're looking for several subtle clues that could indicate that you're kind of heading in that direction. And we're also considering things in your medical history that may predispose you to getting preeclampsia as well. So my really young patients, my older patients, my overweight patients, my patients already with a blood pressure problem, even if it's very well controlled in pregnancy, those are all risk factors for developing preeclampsia later on. So my alarm bells are already going off a little, and I'm watching out for those patients, and I'm paying close attention for those subtle signs.
Great. Earlier, Kelly, you said something about the mirror in a vaginal birth, and I want to tell a story about the first time I met Dr. Morales right here on Facebook. It's going to get mushy. So check, do you guys want to hear it? I bet you guys do. We're going to come back to your questions in just a little bit. Check this out. We got some emails coming up. People are adding their emails in. This is awesome. And we're going to be choosing a winner for the Britex Boulevard Click-Tight Convertible. Try saying that 10 times fast. But yes, we're going to be giving that away tonight, and Britex is going to be so awesome, and they're going to actually drop ship it right to you guys, so you get it in the next few days, which is awesome to whoever our winner is tonight. But I do want to say, when I first met Dr. Morales, I had not met her yet, and I messaged her once or twice, but she wasn't managing her Facebook at the time. It's
still kind of not.
Yeah, it's still kind of not. And I'm like, gosh, I really need to get in touch with her, but I was so busy, and she was so busy. She's a new doctor in our community, and I was at a birth with this couple who they're delivering again soon, because he just called me. I need to meet up with him, and they had another doctor, and I was expecting to see this other physician who's a good friend of mine who I really love as well. She's really buff. I'm not going to say her name, but she is yoked, man. I wouldn't arm wrestle her, that's for sure. Okay, but she didn't. She wasn't there. Who comes in the room but this other doctor and says, "Hi, I'm Dr. Morales," and I looked at her, and she looked at me, and we're like,
it's you.
I've been trying to meet you. She's like, you. I'm like, you're a unicorn. She's like, you're a unicorn. So we had this really amazing time at this birth, and I remember like the pivotal moment was when we were pushing, and my client was really like kind of fading out a little bit, like she was losing her steam, and I needed to redirect her. And there's something that I do that to me is very powerful, and I tell moms, touch your baby's head. She's got a baby crowning, and the baby, you can see all the hair on the baby. She's looking in the mirror, and I go, touch your baby's head. And I saw Dr. Morales' head. She was in the splash zone, so she had her visor on, and the guard here, and she goes like this. She looks up at me, and just those eyes, we looked at each other like, yeah. And she grabs the mom's hand and helps her touch her baby's head. And I'm like, yes, this is awesome. And sure enough, a push later, hello,
done.
Baby.
She was done. She made that connection.
Yes, it was so incredible. I get chills again. That's 3 times tonight, you guys. This is a good show. This is a lot of fun. I'm having a good time anyway. So this is an incredible thing. It's, getting to know your birth team is so important. Yep. And we're going to cover that pretty soon too. Actually, I'm going to be speaking at a midwifery conference in November, and that's what I'm going to be talking about, learning how to choose it and identify your birth team of the people who's in your room. Because one of the biggest things about having a baby is understanding how your room's working and who's going to be your biggest support, how you're going to play everybody together and get everybody to work in a syncytium. That means everybody's working together. Everybody's a vital part of the room, but you have to understand people's roles. It's pretty incredible, huh?
And tour your hospital, tour your facilities so that you get comfortable with, here's the nurses, this is the way the rooms are set up, here's how the nursery's set up, or maybe there's no nursery, maybe it's all rooming in afterwards.
Yeah.
So kind of take that anxiety out of the picture and getting comfortable with your surroundings. You're comfortable in your living room, but you might not be delivering in your living room. So get comfortable with the hospital and go tour.
I am so glad all of you guys joined us. Let's see if there's any other questions we can answer before we wrap this up, because we're about done here, you guys. We will be back. If you guys want us back, say you want us back by sharing this with your friends. Look out for us, because we're going to be doing another one next month, and I'll be announcing that. We'll be adding these in. And if you have a business that you want to advertise on our show, if you're in a baby business, we'd love to have you as one of our sponsors. And we will tell you guys how to do that. You can go to you can go to www.thebirthguy.com. You'll see it at the bottom there, /sponsor. And you can find out more information about that. We'd love to know about that. Kelly, can you tell people where they can find you if they want to learn more about you?
Yes. So located in San Antonio, Texas, I'm at Methodist Hospital. And I believe my website is also at the bottom, or will be at the bottom of the screen. Or it is www.kellymoralesobgyn.com.
The Magician. You guys, I want to answer a couple more questions. Kelly has a question. I absolutely love my OB, Christine Delagarza at 70. Yes. She's wonderful. She's a friend of ours. And I love her. Like, her partner, Heidi Heck, is a sweetie. Oh, my God. They're all great. What a great group. Brian got all of them. All of you. 7 Oaks. Much love. Yep. Okay, but check this out. She says, but having access to something like this is awesome. I wish we could ask endless questions to our doctors at every appointment. Well, you're here in San Antonio, so go to my Facebook, or you're on it right now, or go to my website, thebirthguy.com. Next month, we're going to be doing another Prego Posse, not just one of these. We'll be doing one of these live, but we're also going to be doing a class, and we limit that to 12 couples. You're welcome to come ask me, her, and a guest pediatrician, who we will be speaking with as well, and we'll answer all of your questions. We do about a 2.5, 3 hour session, and that's a good thing. It's called the Prego Posse Live. Look for it on my website, or just message me. We'll let you know when the next one's coming up. We always announce it here on my Facebook. It's an incredible class. It's a lot of fun. Send your dad to Rocking Dads too at Methodist, because it's incredible.
That's an amazing course.
Yes. Okay. Let's see. Tayland has all these people are putting up their emails. It says, how many follicles should a mid-30s woman have? How many follicles?
Wait, let me call my reproductive endocrinology.
Yeah, I don't know, but I'm sure you have a few.
So you probably have a ton. It's more a need to know how many eggs are going to be released. So
it's a need to know basis.
Right.
Yes, we can't answer that, but you need to talk to someone who can actually check that out. Check this out. Natasha says, my blood pressure was out of control. It all happened so fast. Lost my daughter at 24 weeks. Even though my blood pressure was a problem with my other pregnancies, they just dropped the ball with my daughter. Now expecting my rainbow baby, and the doctors every other week are being monitored. Yes, you know what? Yeah, I'm so sorry that happened to you, but unfortunately, it's a crazy world. We have far surpassed our carrying capacity in our ecological system, which sucks. But at the same time, you've got a new baby coming to your rainbow baby, and we're so sorry for your loss. And it sucks that you guys didn't catch that early enough. But man, look, you got to look at the qualities from that baby. Probably will be coming through very strong in your new baby. So you're gonna have a super baby. That's what the rainbow babies are all about.
Super rainbow baby.
Super rainbow baby. Very special. We're really sorry for that, though, for your loss. Let's see here. Good luck to whoever wins. I'm far from needing the car seat. Oh, you're so cool, Jenny Gray Schneider. Thank you for joining us. Lando says, your hubby says, unicorns. And then definitely wish you and the team were closer. We're not that far away, Zach. You're only in Houston. I'm going to be out there for a birth coming up here pretty soon. But I'd love to see you in Miranda soon. You guys have to give me a call. This is awesome. You're doing great. I want to thank you guys, all of you guys. Jessica says good luck to Natasha. We also lost her daughter at 30 weeks. That's why, Jessica, I loved being at your birth with you and Enrique for your new baby. It was awesome. Help Syndrome, we miss her every day. We had our rainbow baby. Oh, I'm getting a little... Because you got it too close to me. You can't do that to me live. Goodness. Oh my gosh. Okay, you guys, once again, we're the Prego Posse. We are so excited to have you here today. Please share this video, even after it's gone, with your friends. Do you guys want to know who wins? Do we have our winner picked? Who's going to win the car seat?
Survey says
the shares.
Here it comes. They're doing a random pick of all you guys with shares and stuff. Go, pick it.
We're gonna roll the balls and then pick a ball out.
Okay, here it goes. But I want to tell you guys, please join us again. Share this with your friends. We're so excited you guys came. Thank you for all the hearts and all the love you guys gave us tonight. Callie, I love working with you.
And thank you for, you're educating yourselves. By being here tonight, by watching this, you are already taking that step towards finding out more about this crazy situation called pregnancy and delivery and postpartum and eventually breastfeeding and all the other insanity that circles around it.
We have so much more to talk about.
We have a ton. Let's
you guys,
do this again.
We are going to tear this up. Next month, you'll be watching out for our next one. We're going to be announcing it, and I want to see where our winner is. Come on, guys, behind the scenes. They are looking right now. Someone forgot to pick a winner. What's up? Anyway, we're gonna announce it right now.
Charlene Grace at Grace 4269.
Charlene Grace. At Charlene, what is it? What's her email?
Grace4269@gmail.com.
Grace4269@gmail.com. Do me a favor, Charlene. We're gonna send you an email. I'm gonna need all your information, or you can email me right now at Brian, BRIAN @thebirthguide.com. go ahead and shoot me an email with all your information, Charlene. We're really excited. There's going to be more giveaways for all you guys, and I want to thank all of our sponsors tonight. Doctors Complete was incredible. I want to thank Kirsten Bruner for sponsoring us. I want to thank Britex for giving us something to give away, and Huggies, as always, every diaper change begins with a hug and ends with a hug. So thank you guys for being here, and we are out. Thanks for watching the Prego Posse.
Bye.
Woo!